I am Delphine Lomax Taylor. I'm an entrepreneur, been in business for 30 years, a company called V&L Research and Consulting Inc. with my business partner, Deidre Virgil. I'm a mother, a wife. I have two grown sons, and I have four wonderful grandchildren and one on the way. I was diagnosed with breast cancer October of 2013. I actually went to a place called the um, Black Women's CBWW Center for Black Women's Wellness. They do mammograms for those that are underserved and also those that are underinsured. It was October 1st. They had a mammogram unit, mobile mammography unit for St. Joseph Health Systems there. And I saw a physician, and then I went on the mammography unit for an exam. After a few days, I got a call saying that they saw something and they referred me to St. Joseph Mammography Center, went for another mammogram, so that was two, and then got a call back that said I needed to get a biopsy. And this went on from October 1st. By the end of October, I was diagnosed with breast cancer. After the three visits, I was told to come to the office, and I went to the St. Joseph Mammography Breast Cancer Center. And when I was there, and my mom went with me, by the way, they brought me into a room, and I thought, something must be up. They sat me in a chair, and the physician said, I've got some good news and bad news. She said, the good news is that I was stage zero. The bad news was that I had breast cancer, stage zero. I had only heard of stage 1 through 4. And so I knew someone, Dr. Roberts Phillips. I had knew her as a renowned breast surgeon. And I went to her and I said, I was told that I had stage zero breast cancer. And she in turn said, you know what? I need to know what I'm working with. I want to do an MRI. So she did an MRI of my right breast. And when I went to her office to get to the results, she said, you have a lot of calcifications. And I suggest instead of getting a lumpectomy, that's what I was told that I needed. She said I would do a right mastectomy. I was totally shocked, but I respected her and I followed her instructions. So after they removed that right breast and they removed lymph nodes under that right arm, I wasn't stage zero. It was stage 2 triple negative breast cancer. I had so much support. I had recently, 3 years before I was diagnosed with breast cancer, I went through a divorce. Had been married for 30 years. This was in 2010. So let's fast forward. In 2013, when I found out I had breast cancer, I was in a new relationship. And when I found out I had to get a right mastectomy, I was like, he didn't ask for this. But do you know, I went to the Walmart parking lot when I found out I had the breast cancer. Didn't know it was triple negative at the time. And I said, you know, we're in this new relationship, but you didn't ask for this. I have to get a right mastectomy. He immediately said, I'm not going anywhere. I'll be here for you. And I just started boohoo crying. My mother at the time was living with me. I had tons of family and friends, my sons. So I had plenty of support. Matter of fact, so much support, my mom really didn't want anyone to go with me to treatment. She would always go with me. So now I look back, that was 2013. And after going through all of the treatments, I had chemotherapy in 2014. I had radiation in 2014. I had many surgeries of breast reconstruction. And now to think that it's 2020 and 2022 and I'm still here, I'm just so thankful and grateful. How it's changed my life, I look at life, I think a whole lot differently. Number one, it still is in the back of my head that it could reoccur. Even though it's been 8, 9 years, you still have that. Sometimes I have that anxiety of it reoccurring. But on the other hand, I look at life and I take it one day at a time. And I try and enjoy life to my fullest. I hate to say live it as if it's my last day, but I try and live each and every day as if it could be my last. And I cherish it and I enjoy it. I would say that for me, early detection is the key. I'd always gotten my mammograms, but I know it was a period of time when I had gone through a divorce. And when you don't have insurance, sometimes you kind of ignore getting those screenings that are necessary. But I'm glad that I kept getting my mammograms because early detection is key. So, my advice or what I would like to tell people is women to get those annual screenings because they're so very important. To read your body, to know your body, I would say to do your monthly breast self checks. If you notice something different, don't ignore it. I would say to get your annual mammograms. Um, yes, it could be uncomfortable, but that one moment of uncomfortableness um, could save your life. And I do believe that early detection is the key and that getting those annual screenings, they do save lives.